Hi, everyone. Welcome to RxConnect. This is a podcast brought to you by the Pharmacy Operations Department at American Oncology Network. And I'm your host, Cassie Perkey, and I'm one of the board certified oncology pharmacists here at AON. RxConnect is a monthly podcast where we break down oncology pharmacy updates and share practical tips to help patients manage their cancer treatment side effects at home. And in this episode, we are recognizing both prostate cancer and Ovarian Cancer Awareness Month by taking a closer look at a class of chemotherapy drugs that have been around for a long time and are commonly used in these cancers, and that is the taxane drug group. So that includes drugs like Paclitaxel and Docetaxel and Cabazitaxel, and these medications really play a big role in treatment for many patients across several different types of cancers, but in particular, prostate and ovarian cancer. We see them used very, very often. So we'll be diving into the top things to know when starting on these drugs and what to expect. And to do that, I am joined by Dr. Manale Maksour, who is a board-certified pharmacotherapy specialist and also the clinical pharmacy services manager at American Oncology Network. She obtained her Doctor of Pharmacy degree from St. Joseph University in Lebanon and has been practicing in pharmacy for over 20 years. She is also a clinical oncology pharmacist at AON who works really closely with providers to treat patients with taxane drugs frequently for ovarian cancer, prostate cancer, and many other cancers. And she'll be sharing her insights from her experience, including what patients often ask about these drugs, which side effects to watch out for, and some helpful strategies for managing those side effects at home. And before we jump in, I just want to give a quick disclaimer that this podcast is intended for educational purposes only, and we may discuss medications that have off label uses. This is not medical advice. Every patient's situation is going to be different, so please always talk with your provider and pharmacist before making any changes to your medications or your care plan. So, Dr. Maksour, thank you so much for joining us on the podcast. I just wanted to start off our interview with a question that many patients are often concerned about with starting on drugs like paclitaxel and docetaxel, and that is hair loss, or also called alopecia. So, can you tell me a little bit about how often this can occur and to what degree it can occur with each of these drugs? And then also about how long does it take before patients can expect to start seeing some hair loss?
Hi, Cassie. Thank you for having me and thank you for your introduction. I'll start talking about the hair loss side effect or alopecia. So, it is actually one of the hallmark side effects of taxane, and it's one that patients always ask about right away. With paclitaxel, we see a hair loss in the vast majority of patients. I want to say like maybe 90 to 100% of patients are going to lose their hair. And with docetaxel, the rate is very high too, probably in the 80% range. The degree of hair loss is usually significant with these drugs, often complete scalp hair loss, but patients are also going to lose hair on their eyebrows, eyelashes, body hair. And for the timing wise, it generally starts within the first 2 or 3 weeks after the first cycle. And some patients will notice increased shedding in that 2 week mark. So the good news is that the hair is actually going to grow back once treatment is complete, although it's going to take several months. And we do notice that the texture and the color may be a little bit different. We also sometimes talk to patients about the scalp cooling system, which can reduce the alopecia for some individual, although the access and the insurance coverage do vary widely.
Yeah, thanks so much for that, Dr. Maxor. I have a little bit of experience with patients using the scalp cooling, and I have seen some success with that. So that's definitely something to look into if you're a patient and you're listening and just have a lot of concerns about hair loss with this. Because, like Dr. Maxor said, with these drugs, unfortunately, it is one of the most noticeable side effects, and it does tend to start fairly early on in treatment. But like she said, the good news is it does come back after your treatment's over. Within like the first month, you'll start to see hair growing back in and fully back in within a few months. So there are definitely things out there to look into, as well as you can also check with your provider's office about getting wigs too. So definitely a lot of resources out there. Um,
Yeah, I want to add, Cassie, also that I think there's a shift in the culture where it's changing from, being embarrassed about a bald scalp to now it is actually a sign of toughness and fighting a cancer. And a lot of people see it now as, a sign of pride versus embarrassment as it used to be. And I think patients also need to be educated and taught about that because we are shifting towards that.
yeah, absolutely. And it's been really just such a positive experience to see that shift as well, like seeing that shift in mentality around the alopecia side effect.
Yes.
Um, some patients, they may have heard that taxanes can also cause infusion reactions, but sometimes we may not know exactly what that means. So, can you help explain what an infusion reaction might look like and how common does that occur?
Yeah, absolutely. And that's a really important point. So, infusion reactions are acute response that happen during or shortly after the drug is being infused. With taxane, these reactions are related to the taxane itself or to the solvent. Paclitaxel is formulated with Chemophor, and Docetaxel is formulated with polysorbate 80. And both of them can trigger a histamine release, which is actually what you'll see in an infusion reaction. So these reaction can range from very mild, like flushing, itching, a rash, to a more serious one. And this is where you see shortness of breath, chest tightening, low blood pressure. For paclitaxel, infusion reaction occur in like 10 to 30% of patients if they're not pre-medicated. But it is our standard to give steroids and antihistamine premedication before the taxane is infused, and that actually drops the rate of infusion reaction dramatically to less than 5%. With the docetaxel, the reactions are less common than paclitaxel, but it is still possible.
And I'll just add with that too, if a patient is to have a reaction to something like paclitaxel, then a lot of times, just because you have a reaction doesn't mean that you can't still receive that drug. Depending on the severity and the type of symptoms that you have with the reaction, sometimes the drug can be held for a certain period of time, and then even restarted at a slower rate. And a lot of times, patients, if they're able to restart, they can continue receiving that drug for several more cycles and complete their treatment. Or in some cases, your provider may choose to hold the that drug that you reacted to and could even switch you to a different taxane drug. Like sometimes if someone reacts to paclitaxel, you may be able to receive docetaxel or another drug called nab-paclitaxel or protein bound or albumin bound paclitaxel. So there are options. If you do find that you have a reaction, you don't have to worry about not being able to receive effective therapy if you have to discontinue that drug. And then Dr. Maksour pointed out some of the signs and symptoms of a infusion reaction, but just to recap that, what would you say are like the biggest things that patients should be kind of looking out for during their infusion, that they would want to let their nurse know about, that might point to an infusion reaction?
So I want to say anything they notice. We always encourage patients to let the infusion nurses know right away if they notice anything unusual. Even the mild symptoms matter. So things like flushing, warm, itching, a little bit of nausea can be early signs of an infusion reaction. And more concerning symptoms, definitely like chest tightness, shortness of breath, dizziness, back pain that just come out suddenly when the drug is infusing. So the key is don't wait and see if it's going to get better. Tell your nurse immediately. We'd rather just pause the infusion, give supportive medication, than risk a reaction that's going to progress to something that's more severe.
Yeah, absolutely, and I will just add that, this is for any cancer institution, not just AON, at any cancer center, like, let your nurse know, if you're noticing any of those types of, symptoms during your infusion, and, Dr. Maksour had, mentioned just a little bit ago about, the use of pre-medications and how those can reduce the risk of some of those reactions, and that's something that is, standard of care across cancer centers, worldwide. If you are curious about what your pre-medication regimen looks like, definitely ask your provider or nurse what drugs are on board to help with reducing risk of reactions. But those should be given to you about 30 minutes before your chemotherapy were to start. The next thing I wanted to talk about was a side effect that is called peripheral neuropathy. It is a relatively common side effect with taxanes that patients, again, may have heard of, but don't necessarily always understand. Dr. Maxor, can you describe what this can feel like and give a general timeline of when patients might start to notice this side effect after they start on one of these drugs?
Yeah, for sure. So, neuropathy is indeed one of the most challenging side effects with Taxane. Patients typically are going to feel like tingling or numbness, or some people say like pins and needle sensation in the fingertips and toes. Over time, it's going to progress upward along the hand and feet. Some patients also describe like a burning pain or increased sensitivity, like discomfort when touching something cold. And in my experience, this actually appears after several cycles. It's not with those first few cycles, usually around a month into therapy, but this does vary based on the intensity and the individual sensitivity. Patients who already have a baseline neuropathy, for example, if they're diabetic and they have diabetic neuropathy, treatments like treatments with platinum who also have neuropathy, they're going to notice it earlier and more severe. So that's why we do stress on documenting baseline symptoms before starting treatment so we can track whether things are changing and intervene earlier if it's needed.
Yeah, that's, definitely so important, for patients listening. If you do have any, symptoms of neuropathy, like that pins and needles, tingling feeling that Dr. Maxor was mentioning, definitely let your provider know before getting started with treatment so they can document if there's any changes along the way. And then, is there anything that patients can do to try to help with preventing neuropathy or keep it from getting worse once it starts, or things that they should be looking out for?
Great question again. So unfortunately, we don't have a proven medication to prevent the neuropathy. The most important strategy is early detection and dose adjustment. And that's what we tell patients. So the moment you start to notice tingling and numbness, just let your provider know. If we catch it early, the oncologist is probably going to adjust the dose, extend interval between cycles, or sometimes even switch to a different therapy. Once the neuropathy becomes severe, it can be long lasting. So the key here is to the early detection and start early. The supportive measurements like good foot care, using gloves when handling cold items, and fall precautions at home can also help the patients manage their symptoms.
Yeah, I think, the bottom line is, like Dr. Maksour said, early detection, and don't be afraid to let your provider know, if you're starting to feel any of these symptoms, even if you think it's nothing, or if it's like or if you think that it's very mild. Your provider definitely wants to know, because a lot of times, with these drugs, when we're using them for prostate cancer or ovarian cancer or any other type of cancer, like, it may be part of a curative treatment regimen, and we expect lots of years of life going on beyond this treatment, and we don't want you to have permanent neuropathy going forward into those years. So just definitely let your provider know if you do start to notice neuropathy. Um, the another thing that we can see with these chemotherapies can be reduced blood cell counts. It's a common side effect with chemo, but is also something that we can see with taxane. So uh, that can cause some complications like anemia, where we have low red blood cells, and fatigue and shortness of breath. We can also see increased bleeding or bruising when we have low platelets, which are another type of blood cell that help with clotting. And then infection when we have low numbers of white blood cells, which typically fight infection. So, can patients see these types of effects with taxanes very often?
Yes, they can. So, bone marrow suppression is actually an important concern with the taxanes. Both paclitaxel and docetaxel can lower blood counts. Docetaxel tends to have a higher risk of significant neutropenia. In fact, actually, patients on docetaxel will sometimes uh, get preventative growth factors, filgrastim or pegfilgrastim, especially if the patient has other risk factors. So, just like Cassie mentioned, low red blood cells can cause anemia, and you'll feel fatigue, shortness of breath. Low platelets can cause early bruising and easy bruising and bleeding. But the biggest concern is always the infection with the low white blood cells. So that's why when we consult patients, we tell them to call their doctor right away if they develop a fever of 100.4 or higher, or if they feel just suddenly unwell during treatment or when they're at home. So these side effects are manageable, but they do require proactive monitoring and good communication between the patients and the team care.
Yeah, and one thing to add with that, with just like generally feeling unwell, one of the other side effects with the taxanes that I've noticed from my experience as a oncology pharmacist is that, especially with paclitaxel and docetaxel, patients can experience muscle aches and just general fatigue for a few days after each dose that can mirror some of these side effects that we see with the reduced blood cell counts and whether I feel like it can be from the drug itself, and sometimes it can be from reduced blood cell counts like red blood cells and reduced white blood cells. But like we a lot of times we'll see muscle aches that can often just be managed with Tylenol or acetaminophen and or ibuprofen or naproxen. So if you are a few days after or you're if you are having some muscle aches or like joint pain a few days after a treatment, call your doctor and let them know. They may ask you a few questions to see if they think that it could be um, like body aches from an infection or if it's more than likely just from the drug itself. And they may recommend that you try taking something over the counter for pain like acetaminophen or ibuprofen. And then as far as fatigue, I feel like that often also follows those muscle aches. So I feel like regardless of which type of taxane drug you're receiving. I feel like that is another one of the more common side effects that we will see. It doesn't happen to everyone, but if you are just feeling a little bit more tired, sleepy than usual, or just a little bit more achy for a few days after each treatment, that is totally common and something to be expected. But make note of that and let your doctor know at your follow-up appointments for sure. Um, and then just a couple other points before we wrap up our podcast for the day. I wanted to mention one of the supportive care medications that we use alongside docetaxel, and that's dexamethasone. And this is something that we've talked about on a previous podcast when we talked about nausea and vomiting and how to manage that at home. Dexamethasone is one of the steroid medications that is usually prescribed to help with reducing nausea and vomiting, and is often taken for a couple or even up to 3 days after chemotherapies that can cause nausea or vomiting. But with docetaxel, we typically your provider will have you take that the day before, the day of, and the day after docetaxel to help with reducing a side effect called edema or fluid retention, where you're just having a little bit more swelling and retaining more water on your body that can happen with docetaxel. If you are taking dexamethasone with your docetaxel, it's usually prescribed to take twice a day for those 3 days, starting the day before your each docetaxel treatment. Um, with taking it twice a day, you'll take your first dose, of course, in the morning. You want to take dexamethasone with food, but also, for that later afternoon dose or evening dose, we do usually recommend that patients take that like in that late afternoon range, rather than maybe like with dinner or at bedtime, just because dexamethasone is kind of a like activating drug. It's something that can make you feel more awake. So taking it around like that 4 o'clock, 4:30 p.m. time frame can give you enough time, hopefully to let it kind of get into your system and hopefully still have a good night of sleep after that. So, just some important points for that supportive care drug that we see given alongside docetaxel. But that is all I had for the podcast today. Thank you so much, Dr. Maksour, for sharing such helpful and practical tips from your experience as an oncology pharmacist. And to our listeners, remember that you do not have to wait until side effects are severe to speak up. Let your oncologist team know if you notice any new symptoms or changes, even if you are not sure if they're related to your treatment, or even if you think that it's just mild and you're being a bother to someone. Trust me, you are not a bother. We want to know what's going on. That is the best way for us to be able to support you and make adjustments if needed. So I hope that today's conversation helped you feel more confident about what to expect if you're starting treatment with a taxane like Paclitaxel or Docetaxel or Cabazitaxel. These are medications that are a very important part of treatment for many cancers. And while these side effects can happen, there is a lot that we can do to prevent them or to manage them early and keep you feeling as well as possible throughout your treatment. So, thank you so much for listening, and we will be back next month with another topic to help support you during treatment. So, if you found this helpful, we'd love it if you shared this episode with a friend or a family member.
All right. Thank you, Cassie.
Thank you, Dr. Maksour.
The RxConnect podcast is produced by the pharmacy operations team here at American Oncology Network and music composed by the Synth Dude. Make sure to check out all our episodes of the podcast by liking and subscribing to our YouTube channel.